Bipolar Disorder by Herschel and Ruby Urbina, Mental Health Nursing 106-E06. Bipolar disorder, a medical condition that causes a person to cycle through periods of depression and elevated mood. The precise causes of bipolar disorder are unknown. However, there is a strong evidence that biological factors, including genetics, play an important role. Stress or difficult family relationships do not cause the illness. Scientists believe that changes to genes can lead to faulty proteins being produced within brain cells, which may then result in bipolar disorder. The anatomy and physiology of the brain. Parts of the brain that bipolar disorder affects: the prefrontal cortex. This part of the brain plays an important role in mood-related disorders and is responsible for cognitive control, impulsivity, and attention. Gray matter, this is the outermost part of the brain. Gray matter processes information and is important for movement, emotions, and memory. The hippocampus, this part of the brain, plays a role in emotions and memory. Key neurotransmitters affected by bipolar disorder. Dopamine, a happy neurotransmitter involved in memory, mood, motivation, and movement. Serotonin, often called the body's natural feel-good chemical because it makes us feel happy and calm at normal levels. Norepinephrine plays an important role in your body's fight or flight response. About the patient, name is Amelia Evans, 19 years old, female, a Canadian, lives in Regina, living arrangement, family home, diagnosis, bipolar disorder, and a history of psychobiological disorder, new onset of bipolar disorder, comorbidities, none, existing social support, living alone. Nursing process, therapeutic communication. I will be quiet and just sit here for a while, and if in case you need something, I am here to listen. Deliberate silence can give both nurses and patient an opportunity to think through the process, what comes next in the conversation. You can talk and share to me whatever you like. I am here to listen. Active listening involves showing interest in what patients have to say, acknowledging that you are listening and understanding and engaging with them throughout the conversation. NANDA Priority Nursing Diagnosis. Risk for injury related to extreme hyperactivity, destructive behaviors. Individual coping ineffective, alteration in thought process. Treatment goal. Psychological treatment, individual psychotherapy may be used to identify stressors and pattern of behavior. Group therapy establishes a supportive environment and redirect inappropriate behavior. Family therapy verbalizes family frustration and establishes a treatment plan for outpatient use. Somatic and psychopharmacologic treatments, electroconvulsive therapy, and psychopharmacology. Nursing interventions. Assess client suicidal feelings and intentions and escalating behavior regularly. Set consistent limits in inappropriate behavior to help the client de-escalate. Establish a calm environment for the client, reinforce and focus on reality, provide outlets for physical activity but prevent client from escalating. If the client cannot control self and other methods are not successful, staff may need to provide client protection if a threat of self-harm or injury to others exists. Discuss with the client and family the possible environment or situational causes, contributing factors, and triggers for mood disorder with recurrent episodes of depression and mania. Nursing evaluation. The goals are met as evidenced by client is able to differentiate between reality and unrealistic events or situation. Client is able to recognize thoughts that are not based in reality and intervene to stop their progression. Client has gained or maintained weight during hospitalization. There is no evidence of violent behavior to self and others. Client is no longer exhibiting signs of physical agitation. Treatment outcome. The client will respond to the medication within the therapeutic levels. The client will be free of dangerous levels of hyperactive motor behavior with the aid of medication and nursing interventions within the first 24 hours. The client will take a short voluntary rest periods during the day. The client will be free of excessive physical agitation and purposeless motor activity within 2 weeks. The client will be free of injury within 2 to 3 weeks. Erikson stages of development. Identity versus role confusion. During this stage, adults explore their independence and develop a sense of self. As they transition from childhood to adulthood, teens may begin to feel confused or insecure about themselves and how they fit into society. Pharmacological interventions. Mood stabilizers. Lithium is the drug commonly used for prophylaxis and treatment of manic episodes. Lithium is one of the most widely used and studied medication for treating bipolar disorder. Lithium helps reduce severity and frequency of mania. It may also help relieve or prevent bipolar depression. Patient teaching on lithium drugs. Take this drug exactly as prescribed after meals or with food or milk. Swallow extended or controlled release tablets whole. Do not chew or crush. Discontinue drugs and notify your healthcare provider if toxicity occurs: diarrhea, vomiting, ataxia, tremor, drowsiness, lack of coordination, or muscular weakness. You may experience these side effects: drowsiness, dizziness, avoid driving or performing tasks that require alertness, GI upset, eat frequent small meals, mild thirst greater than usual urine volume, fine hand tremor, may persist throughout therapy. Notify your healthcare provider if severe. Community support resources. Regina Adult Mental Health Clinic, 3rd floor, 211 Hamilton Street, Regina, Saskatchewan. Phone number 306-766-7800. Fax number 306-766-7811. Regina Child and Youth Services, 1680 Alberta Street, Regina, Saskatchewan. Phone number 306-766-6700. Fax number 306-766-6944. Randall Kinship Center, 680 Albert Street, Regina, Saskatchewan. Phone number 306-766-6780. Crisis Intervention Resources. Mobile Crisis Service 211 Saskatchewan. Hotline 306-933-6200. Fax number 306-664. Saskatchewan First Responder Mental Health 911.